To start, I love for everyone watching to get to know you a little bit more. So can you share a little bit about your background and your role in the field of medical legal death investigation?
Sure. My name is Brandy McCluskey. I am a forensic pathologist by medical training and serve as an associate coroner medical examiner for Jefferson County in Alabama. We are one of the only fully functional medical examiner systems in Alabama. We're stationed primarily in Birmingham. And I let's see, I went to medical school and then did a residency in pathology and then a fellowship in forensic pathology, all at UAB, where I stayed on as faculty. I have been working as an associate coroner medical examiner for Jefferson County for almost 7 years now, doing a lot of work with trying to empower public health data, and a lot of that work with Acoer has made that possible.
Thank you so much, Brandy. So next, I would love to kind of dive into, I feel like every, critical field like this encounters challenges. So I would love for you to discuss some of the main challenges that professionals like you may face when it comes to public health reporting and data management.
Yeah, unfortunately, forensic pathology and coroner medical examiner work is not usually at the forefront of healthcare policy and resources, despite our important work for understanding the health of the nation. Um, so there's a lot of challenges in recruiting people to forensic pathology to serve as medical examiners in this country. We're at a large workforce deficit for um, pathology in general, but for forensic pathology particularly. Um, so without having qualified individuals at the helm of medical legal death investigation, it makes the data coming out of our offices and medical legal death investigation maybe less than ideal. Of course, a large proportion of the country is uh, in coroner jurisdictions. So there are a lot of lay people and elected coroners that serve the country for medical legal death investigation, which can also present some challenges due to a lack of standardization in how we all complete death certificates and collect death investigation data. There are a lot of groups trying to work towards standardization or towards, at least education and information for the public and for individuals who serve in these roles. Um, some of the main challenges are around resources in general. So making sure offices are not just well staffed with individuals outside of the former medical examiner positions, but also other staff persons, but making sure that they have the resources they need. Some coroner offices are working without computers. Some medical examiners offices don't have case management systems. So there's a lot of resource allocation that doesn't make its way to the medical legal death investigation community, and therefore creates a lot of challenges in the quality of the data that they can provide back to national health organizations and the CDC, as well as to families.
Okay, wonderful. Yeah, I think as you know, at Acoer, we're we're on our end dedicated to leveraging technology to enhance healthcare solutions, and pain points like what you just mentioned are basically what inspire the development of our applications. And speaking with that, so you have the challenges. I would love to tie them to technology and hear how you feel that technology can play a role in addressing those challenges that you mentioned. In some areas like improving efficiency, accuracy, and collaboration.
Yeah, I mentioned case management systems, which are sometimes homegrown, sometimes more um, commercially available type products that different offices can use, but everything operates in its own little silo within the offices typically. And so the main tool that we have from a public health standpoint is the death certificate, which we've already alluded to, has a significant amount of issues. And even though it is electronic and there's a lot of work being done to make that a more efficient process. It still is redundant and requires a lot of personnel time to complete. And so leveraging technologies that can work on interoperability and allow case management systems from offices to communicate with larger databases or like record systems is really helpful. In our world, a lot of people want the information we have for certain reports that they need to do. And so that becomes also a very labor intensive process within offices. So being able to communicate through our different reporting systems and case management systems, or have another layer of technology that could exist to help communicate between the two, would help. I've already mentioned the decreased manpower that
For
the
sure.
medical legal death investigation world has. So anything to make that more efficient, where we can collect the data once and then it can go where it needs to go without us really having to participate in that much, would be very helpful. The other part of this is that if we could communicate with each other utilizing our primary data sources that we collect within each of our offices, then we can empower the data much more efficiently and effectively than just the few check boxes on the death certificate. So there's a lot of investigative information um, or mortality related data that would be useful that we collect at the primary level that never gets translated in an effective or efficient manner to public health data.
Wow. So it sounds like a lot of time is spent on not only collecting data, but um, communicating different insights and tracking trends and all of that. There's a lot of inefficiencies in communication, and so streamlining
Right.
that would be important.
Yeah, absolutely. We've had a number of projects where we've worked collaboratively with yourself and others, and to help increase the communication back to our health departments, for mobilizing Narcan training to certain hotspot areas, um, by being able to identify demographic shifts, which we saw during the COVID pandemic, with fentanyl adulteration of all drug types. So being able to identify at-risk communities that may not have been affected as much by the opioid epidemic, but
Mhm.
were once the supply chains were disrupted. So being able to like see those things in a much more um, time effective frame, a more effective time frame was really useful for us. And having data visualization tools to be able to do that effectively was really important. It helped us get some messages out to the community when we really needed to. And so being able to see trend data in a shorter time frame than what is typically possible at the national level, or with the National Vital Health Statistics System, which is often many months, if not a year behind, is really more useful for our public health colleagues that are trying to do interventions on the ground.
Okay. Well, thank you for sharing insights into that. I think that those are some areas a lot of people don't necessarily think about
Yeah.
on a daily basis, but it's extremely important to address. So, yeah, thank you for that. And I know you briefly touched on this. I wanted to shift a little bit into something that's very important to us at Acoer. And I know you're a very strong advocate for addressing this as well, but I wanted to chat about disparities in health data. Our team has been working recently. I know we've had conversations as well on organ data. So I'd love for you to dive into that a little bit further and chat about what are some of the key disparities that you observe in health data and how can addressing these disparities improve public health outcomes and enhance qualities of investigations and better serve communities.
Yeah, there's some of this that's slightly, outside of the scope of where I come from in the medical legal death investigation world, but from a general healthcare landscape, there is a lot of still stigma and lack of trust, I think, overall, from certain marginalized communities. And I have medical students sometimes that come through our office to learn, and residents to learn during their training, and they're often shocked to see natural disease processes that have killed individuals in the community. And I think people forget that even though we're in sort of a mecca of healthcare availability, that doesn't exactly mean that it is being effectively delivered to individuals who may need it the most. In terms of, being able to provide that data back is very challenging, particularly in looking at the general burden of heart disease or diabetes or COPD, which are things that are talked about a lot, or even obesity, are high topics of interest, but understanding the true burden of disease on the actual public is something that I think the medical legal death investigation systems are able to provide. That's often overlooked, honestly, where if we have a high proportion of um, deaths due to things that people tend to pay attention to, whether that's the opioid epidemic or violence, which are important for sure.
Definitely.
But there is also a subset of our population that are individuals out in the community that do have a lot of distrust in healthcare and do not seek treatment for treatable diseases that carry a high morbidity, and sometimes mortality, but they're not actually seeking treatments that they require. So we ended up being, there's some articles out there, and we sometimes refer to ourselves as the primary care doctor for the dead, because we may be the first doctor they see. And I think that's important for their families to understand that they're being cared for. And then hopefully, we can help build some trust back into just the overall healthcare system. There is, there's a lot of literature, and there's been some recent changes to some of the medical decision-making processes
Mhm.
for certain demographic groups uh, with ailments like kidney disease. And so there's, a lot of times the medical legal death investigation system is one of the checkpoints in terms of organ donation or organ procurement during after an individual or uh, after an individual has died for certain tissues, or right before they are officially pronounced dead. Maybe that's in terms of organ donation. So once an individual is within the jurisdiction, falls under the jurisdiction of a medical legal death investigation, then there's another step to the process in terms of approval for that. And so, making sure that our communities are educated about the importance of donation, and where the lines can be drawn from the medical legal death investigation world, I think is really important. Making sure that we understand that we both have missions to serve, and patients to take care of, even though, I guess my primary patient is already dead. There's a lot of people associated with that individual that deserve information too. And so making sure that the two worlds can work together in parallel without actually impeding each other's progress is really important to me too.
Kind of touching on, I know we've talked a little bit about technology as a whole and data management, but another area I would love to talk about, since it's a big part of what we do here at Acoer, is blockchain technology. Um, and kind of from your perspective, how you see something like blockchain technology addressing some of the challenges that we talked about today, whether it be in public health reporting, data management, health disparities, all in, trying to contribute to the integrity and security of health data.
That it is quite, has this transactional component that is trustworthy. And I think when we're talking about the health data of individuals, there's nothing more than integrity of
Mhm.
the data at the forefront. Um, all health information systems are focused on building as big a walls as possible to keep as many people out. And it seems every day there's some new attack of some sort. And, data security, I think, is at the forefront of a lot of information systems and those that manage them. And so I think something like blockchain can help, um, provide some security to the individuals that are using that or collecting that data and sharing it. And so that's always been something that I felt was empowered the collaboration that we've had over the last few years is because many people that work in the fields that I work in are very protective of the data they have. There is a lot of authority given to coroner medical examiners for good reason. We need to be independent agencies outside, free of outside influence from law enforcement or, district attorney's offices. We need to be sort of the voice for our patients without being influenced by others. And so making sure that that data is secure and shared only when appropriate, and that there are certain components that can be shared with certain individuals, but not others. But I think the blockchain technology really helps us feel comfortable doing that. Um, you know, EMR and electronic medical records as a whole separate ball game. And so where we operate in this, sort of gray zone, it makes it a little bit easier to help inform public health and inform our, other researchers or like the district attorney's office or other jurisdictions with the information that we're collecting, or we have a data sharing with the DEA. So making sure that we can provide these pieces of information and reporting them out. Um, we're trying to do it as quick as possible in a shortest time frame as possible, but knowing that we can trust that information and that it's not, altered along the process, and that we can see, kind of again watch the transactions take place, I think is really a critical piece of this.
This has been an amazing conversation. I think it leaves a lot for people watching to think about, a lot of important topics and areas where we all need to come together and take next steps to make an impact and change moving forward. So thank you so much for having this conversation with me. It's been incredibly insightful, and I just want to thank you again for all that you do to serve our community as well. So thank you, Brittany,
Thanks,
and
Sam.
yeah, I appreciate you taking the time to speak with me. This has been wonderful.
Thanks.